Hello, I am Willie Brooks, the President and CEO of Detroit Wayne Mental Health Authority. First, I want to thank our Board of Directors, leadership, staff, providers, community, but most importantly, the people we serve. Thank you for allowing us to assist you and help you lead a life of inclusion and independence. We are all working toward the same goals of inclusion, hope, and recovery. I am proud of the work we do, and I am eager to move forward with new plans in a new year. The Detroit Wayne Mental Health Authority is going through a transition with our system transformation plan. And through this major shift in our provider network, we have ensured that the people we serve will always come first and foremost in everything that we do. We've had ongoing communication with our providers, people served, and community stakeholders throughout this process to ensure processes are followed, efficiencies are met, and most of all, that the delivery of services were not impacted. I can say that the state of the authority is good. In our system transformation plan, we are working directly with over 500 provider organizations, have hired over 50 new employees, established a new residential department, and acquired several new buildings. The goal of this transformation is to offer more resources to the people we serve. The provider network would offer holistic care in 5 life areas, including behavior, economic, physical, social, and spiritual well-being. We want individuals receiving services to have the best opportunities to be independent and have opportunities for inclusion in their place of employment, worship, schools, and the communities of their choice. System transformation has been a major undertaking. With any kind of major change, there will be bumps along the way. System transformation has been a success, and we are moving in the right direction, which is managing care rather than simply funding it. As many of you have heard me discuss, the Detroit Wayne Mental Health Authority is viewed as a national leader on how we care for nearly 80,000 citizens we serve. This should make us proud, but also motivate us to continue that reputation to be even better than we were the day, week, or year before. We should always look for ways to innovate and improve. One of those ways we are innovating is we will soon launch a pilot program with health plans to see how well we can marry the integration of behavior and physical health, always keeping in mind the people we serve and their well-being. This will be an opportunity to set the stage for the nation who will be watching closely to see if these two very different systems can work well together on the same goal, helping people become well and stay well. This year, we will have a new governor and many new legislators who need to know how vitally important community mental health is to the state. Our executive leadership team has already had discussions with leadership in Lansing to ensure that mental health care is at the forefront of conversations. We are working with advocate groups and other counties to educate the new crop of lawmakers that will make Lansing their home for the next few years on matters that are important here in Wayne County and throughout this region. Another major initiative is our Crisis Continuum Plan. We want to establish several crisis centers strategically located throughout the county. This is sorely lacking in the state, and Detroit Wayne has an opportunity to create this continuum of care for all of Wayne County and show others how it can be done. We are also in discussions with local law enforcement about how those that are incarcerated can have access to proper mental health care services. We will be more involved and more visible in the school system, making available more resources to children, youth, and families who need behavioral health services. Our goal is to make our community, our country, our world a stigma-free place to live. Our focus is and always will be the people we serve. We will continue to strive to be the premier safety net organization offering a vast array of services and supports to help people find resources, to help them recover, help them heal, and live a life of independence, inclusion, and freedom from stigma. We are here to talk, here to help, and I look forward to working with you. Thank you very much. And here is to another year of dignity and respect for all people.